Good day, my name is Dr. Dwight Reynolds. I'm the President, Founder, and CEO of Centers for Health Promotion. I'm board certified in emergency medicine, have been so since 1985. Trained at the Cleveland Clinic in Cleveland, Ohio, in general surgery. Our primary goal at Centers for Health Promotion is to educate the people so that we can give you the information that you need to better take care of yourselves. We're dealing with such issues as hypertension, heart attacks, strokes. We're looking at diabetes, smoke-related diseases such as emphysema, which is a major problem, both healthcare-wise as well as an economic strain on our healthcare system. We're looking at such things as infant mortality, maternal mortality. These things all are major problems within our communities. We're looking also at mental health. Mental health is a major component of what's happening in our communities, such as depression, post-traumatic stress disorder, and other significant mental health challenges that we have. Oftentimes in our communities of color especially, we tend not to want to talk about these things, but these things are critical for us to talk about, get out, and educate our people on doing that, or recognizing what those symptoms are, and more importantly, being able to show them how we can manage them through the process. So we do have our mental health specialists to do just that.
This is Dr. Rudolph Moise, Vice President for Center for Health Promotion, with Dr. Dwight Reynolds being the president of these great organizations. We created this company a couple years ago, and we focus on COVID prevention by giving COVID tests, COVID vaccines, and also prevention of chronic diseases, particularly in the minority area. Though we treat everybody, however, we are laser focused on the minority population because of the disparity that exists in this community. And for this reason, we partner with the different churches, organizations, and the pastors provide us the access to their church members so we can reach a greater number of individuals who may be affected by these different chronic conditions.
My name is Christine Reynolds. I am the Chief Financial Officer of Centers for Health Promotion. Centers for Health Promotion is set to provide community health services to the uninsured and to those in need of help. I give thanks to God, who has made it possible for Centers for Health Promotion and Dr. Dwight Reynolds to carry out this mission.
How you doing? My name is Justin Reynolds. I am the Fitness Outreach Director at Center for Health Promotion. In this community, I will say this, the overwhelming, which is, I believe, is 50% of 4 in 10 Americans, which is 100 million people, 50% of them are African Americans. And that 50% is obesity. And that is not good. So kind of what I like to do is I try to go around different areas, different events that I can get to, and see if I can talk to certain people that are interested in setting a different lifestyle, so on and so forth, and kind of go from there. You know, it's kind of funny. A lot of people really don't know that they need me until their doctor tells them to.
Good afternoon. I am Pastor Richard Dames. I am the Senior Pastor of Hopewell Missionary Baptist Church, and I'm also affiliated with CHP. And today I just want to talk about the importance and the impact of not just being a pastor over the church, but also serving in the community. And in this partnership with CHP, we have been able to impact not only our church community, but we've had an influence inside and outside of our various communities. And in addition to that, our communities have seen the great impact from the work of CHP as we've been able to not only serve the undeserving, but also to make an impact in the lives of what I like to call the lost, the least, and the left out through health screenings and being able to provide all of these necessary benefits for our people who ordinarily would not be able to afford them. So it is just a great benefit and a blessing to be a part of this great agency of CHP under the leadership of Dr. Dwight Reynolds.
My name is Pastor Toby Philpart. I serve as the senior pastor here in the city of West Palm Beach. I also serve as moderator of the Florida East Coast Baptist Association, giving me the humble opportunity to give oversight and consultation to over 75 churches here in South Florida. Therefore, we mention those statistics because we desire to bring some assistance to the efforts of Dr. Dwight Reynolds and the organization Center for Health Promotions. The Florida East Coast Baptist Association, through our 75 churches, that gives us influence well over 100,000 persons in South Florida area. When you look at the Florida General Baptist Convention and the 400 churches, we serve and influence as a body of ecclesiastical leaders well over 400,000 persons. One of the major benefits that attracted myself and other ecclesiastical leaders about Center for Health Promotion is their ambassador program. They have a program that literally educates church leaders, lay persons, as to how to take this information into the community. And so when you consider our influence over 400,000 persons, that then in this partnership allows us to truly penetrate all communities.
Hello everybody, I'm Pastor Arthur Jackson III, and I'm the proud senior pastor of the Antioch Baptist Church here in the beautiful city of Miami Gardens. I'm excited to announce a phenomenal partnership between Antioch and the Centers for Health Promotions, better known as CHP. Listen, this is a phenomenal opportunity for the residents and community partners here in the beautiful city of Miami Gardens and vicinity to come to get more information regarding chronic diseases and vaccinations and informations on how we can have a better quality of life. Jesus declared that he's come that we may have life and have life more abundantly. There's going to be a health mobile clinic here on premises, doctors available to give vaccinations and information on how we can have a better quality of life. I'm grateful to God for Dr. Dwight Reynolds and the CHP staff for this wonderful opportunity to increase the quality of our lives.
What made me come to get tested, everything is that healthcare is vital. So even though I have my own primary physician, you can't be knowing what your glucose is, your cholesterol is, your blood pressure, so that you can be preventative. So everybody get their healthcare done routinely.